Hello, and welcome on behalf of CME Outfitters. I'd like to welcome and thank you for joining us for Caring Beyond the Counter, Cultural Awareness in Action. The CMEO Snack Series is supported by an educational grant from CVS Health. I'm Dr. Jasmine Gonzalvo, and I have been faculty at Purdue University for just about 20 years, and I also practice clinically at a federally qualified health center that serves approximately 85% Spanish-speaking populations. I do cardiovascular risk reduction and medication management for high cardiovascular risk patients. I also serve as the director for the Center for Health Excellence, Quality, and Innovation at Purdue University. I'm so excited to be joined today by my distinguished colleague, Dr. Maria Hearns-Rivas. Dr. Hearns-Rivas, can you please give us a quick introduction?
Hello, my name is Dr. Maria Hearns-Rivas. I am an ambulatory care pharmacist with 10 years of experience. I have had the honor of caring for Spanish-speaking patients throughout the state of California, from Ukiah to San Isidro. I currently work for an integrated healthcare system in Southern California, and today I hope to share with you some of my best practices when caring for a Spanish-speaking population.
Wonderful. Now, to frame the discussion today, let me first start by reviewing our learning objectives for our program. Our learning objective number 1 is to identify common cultural beliefs and trust-related factors that affect perspectives on illness, healing, home remedies, and the use of medications in Latina patient populations. And secondly, our second objective will be to integrate culturally responsive communication strategies to address traditional remedies, community influence, and health beliefs alongside evidence-based recommendations when counseling Latina patients on medication and chronic disease. Maria, let's start off with building upon what we've already learned in the other episode and about language and why it matters. Can you kind of get us started on that topic?
I would love to. And here is a quote and insight from PhD candidate Esperanza Santos. A suggestion she provides to us healthcare professionals when speaking to our patients is the following. As my patient, I want you to feel understood and respected. I am going to use a few words that you may identify with. Let me know which one you want me to use for you. Hispanic, Latino, Latina, Chicano, Chicana, Latinx, Latine, or something else.
Thank you for kind of setting that groundwork for us, Maria. Now let's explore how that linguistic respect translates into action through trust, empathy, and culturally responsive care. Trust and cultural context in pharmacy care, we need to know why it matters first to really center our discussion today. If you look at the bottom of the pyramid, we're really looking at a foundation of trust, which must first be built upon. We're looking at competency and reliability. And for example, that may start with, in the pharmacy world, we're talking about accurate dispensing and refills. That's a very pharmacy-centric thing that anybody wants to rely on. They need to be getting the right medicine dispensed at the right time, right dose, all of those things. So that's a baseline expectation that we should be very comfortable, obviously, providing as pharmacists. On top of that, looking at caring, community, and respect. This isn't specific to the Latino population. Of course, if you can think of any human being, they want respect, they want to feel genuinely cared for. And if we're able to approach our patient interactions in that way, we're also doing a lot in the way of building trust and also providing context for our interaction. Clarity and transparency. Also a really important part, again, not necessarily specific to our Hispanic or Latino cultures, but even excellent clinicians fail if they don't clearly explain steps, rationale, costs, alternatives. You know how frustrating it can be not knowing what the cost may be for any medication and how you may feel if you're surprised at the pharmacy counter or anywhere along that interaction where there hasn't been transparency and unexpected surprises really gets in the way of building trust and clarity and transparency. And then at the top of the pyramid, you'll see agreement and commitment. And trust can really be established when a provider and patient align on a plan, and both parties are committed to it, right? It's not just the prescriber or the provider talking at the patient and the patient just sort of going along and agreeing, but there is mutual agreement between the prescriber and the patient. And that goes a really long way when we're talking about trust and cultural context. And that is really what we can see be supportive of long-term behavior change that can be really difficult for people. But when we're creating an environment of trust, rapport, transparency, and cultural context, that's when we're doing our best job as pharmacists in providing optimal care, when we can do that, particularly in our Latino or Hispanic populations. Maria, would you like to talk a little bit about the kind of different spheres of influence in the space?
Yes, absolutely. And thank you so much for that. Very nice setup. Now, in terms of the influence of spheres, so yes, the patient is going to be at the center of pharmacy care, but there may be some spheres of influence that we must consider. The family, church and community, media and environment. And so here, the decision making is often collective. For instance, a patient might be thinking, mi comadre said, and this can potentially outweigh the prescriber's advice if the trust is low. Social media and digital connectivity may often amplify drivers of health, and we need to weigh the impact of this when counseling patients on medications. Anything else you would like to add?
Yeah, I think another piece that we as pharmacists really just need to be attuned to is body language, right? And are people responding in a way that really shows agreement or excitement or buy-in to anything that's really being discussed? And so I think that when we're talking across cultures and we're really trying to be attuned to cultural context, I do really think that we need to be paying attention to body language as well. We're going to be talking so much about language, right, Maria? And language alone is not the full story when we're talking about a patient interaction and long-term behavior change, and really being attuned to the full environment, the full picture, the full interaction. So that's all I wanted to add there. And trust has such a cultural context. Did you want to talk a little bit more about that, maybe in terms of beliefs, healing, or home remedies, Maria?
Absolutely. Thank you so much, Jasmine. So yes, sometimes I'd even like to say that honor traditional remedies and spiritual practices. If it makes a patient feel good and if it's not causing them harm, perhaps allow them. Just make sure that they don't stop their prescribed medications.
Right, absolutely. And I know that that has come across a lot in my patient care as well. And can I just try sometimes, what is it? Maybe some sort of cactus juice. I've heard that one. Or some other type of home remedy. And I think it's our job as pharmacists to make sure, first and foremost, that anything that the patient may be taking is safe, right? Can we run the interaction checker just to say, okay, there are no critical interactions that would be of concern with the pharmacologic and potentially supplement medications? I think that would be our first job. And Maria, I think what you were also alluding to is basically if there's no harm with the interaction and somebody really is committed to and believes that something is helping, that oftentimes it's okay for them to continue taking it. Who are we to get in the way of that, as long as it's safe from our perspective? And again, that the pharmacologic treatments are still being prioritized, and the patient feels comfortable taking the pharmacologic as well as their supplements as well. And just kind of continuing on that idea of safety, right? So the medication interactions, pharmacists are often the first point of contact for self-treatment and supplement use. And as pharmacists, we want to recognize the ethnic and the cultural differences and beliefs about those herbal remedies. Do you want to comment on that, Maria?
Yes, and just to piggyback off of what you just explained, which I agree with everything that you just said, first let's weigh the risk versus benefit with the patient. And if the patient would still like to proceed with their supplement, then perhaps we can consider the statement about monitoring plans instead of bans. And of course, document what we agreed upon in the patient's profile.
Absolutely, Maria. You know as well as I do that if we say, no, that's not going to work, or why are you doing that? Or you're wasting your money, right? That actually does quite a bit more harm in terms of the trust and the rapport and the safety in the relationship, more so than that supplement may be doing harm to them. So yes, being supportive and just checking for safety is usually where we want to prioritize our efforts. And looking at kind of mental health and diabetes management, and really this idea of what might also be misconceptions sometimes. I know I can share an experience here. In my patients, sometimes I also notice I've heard some people associating metformin with kidney damage, right? And again, my patient population is largely Spanish speaking, but this can be applied to really any patient population. There may be misconceptions. For example, metformin is harming my kidneys, or insulin is a terrible thing that really may ultimately harm me more than helps me. And some of those misconceptions being out there, I really do like to approach those types of conversations with motivational interviewing. And if somebody brings that up, I may say, can you tell me a little bit more about that fear? Or can you tell me a little bit more about what you're thinking there, or what's happened that you have those beliefs, right? And once they share that with me, the next thing out of my mouth might be, do you mind if I share some additional information about that idea, right? And that might be where we say, what we know is that high sugars can cause damage to the kidneys. And what we know is that metformin needs to get out of your body through the kidneys. And if the sugars have done the damage to your kidneys, that's where we can get into trouble with metformin, versus the metformin doing the direct damage to your kidneys or something along those lines, right? So motivational interviewing there can get us through with adequate empathic communication some of those misconceptions, or what may be sort of cultural beliefs that may lead the patient down sort of a different thought path than is healthy for kind of any pharmacologic options that we want to share. Maria, do you want to expand on any of that?
I mean, everything that you said, it's like I've been there and I've had these conversations with my patients, whether it was metformin, like the three top ones that I can think of is metformin, insulin, or if a patient was contemplating a medication for depression. So I agree with you. In these instances, I'm always coming in with, or at least I try to always come in with a mindset of curiosity. Where is this coming from? Where did you gather this information, etc.? And it could be a whole wide set of answers from my neighbor, my sister, etc. And then also, as you beautifully put it, asking them, may I share with you some further information? And then that's where we can fill in the gaps that they might have, or further demystify some misconceptions, whether it's helping them, cross that bridge and understanding that metformin, no, it will not cause end-stage renal disease, or insulin will not cause end-stage renal disease. Oftentimes in those particular instances, I share with the patients, well, how is that loved one doing, etc. Oh, were they already in dialysis? Okay. So oftentimes I help them connect the dots of, if we don't do anything now, and if we don't start this medication now, then later on down the road, when the kidneys truly are starting to fail, and it's no longer to, for instance, as you mentioned, to start the metformin, or there's so much damage from the sugar, not from the medication, that cause a patient to end up in end-stage renal disease, yeah, insulin might end up being the only option at that point. And then also for like mental health, there's a lot of misconception about it's an addictive medication, et cetera. There's a lot of fear about that. In this particular scenario, I further inquire to ask about, what it is that the patient believes. I ask for permission to share additional information. And then my goal is always to help them bridge that gap, in the sense of like, this is what I understand, but this is in fact the missing information that I have. So for instance, If a patient is hesitant to start a medication for depression, the way that I like to, simplify it, make it a little bit more digestible is in the sense of like, well, just how sometimes there are medical conditions in which the heart needs a certain medication for treatment, or our thyroid has a condition and we need a certain medication for treatment. Then it is okay that if our brain has a certain condition, such as depression, it might need a medication for treatment. So I try to simplify it. I try to listen carefully for the language that they're using so that I can reflect that and hopefully help them bridge that gap.
Maria, I'd like to expand a little bit more on motivational interviewing in a cultural context. Clearly, you and I are bought into motivational interviewing and we're very comfortable using it, but perhaps maybe not all of our audience is quite as comfortable. I'd wonder if you could go into a little bit more with motivational interviewing in a cultural context.
Absolutely. And thank you so much for bringing that one up. So let's not forget, as you mentioned, motivational interviewing and how the ORS, or open, affirm, reflect, and summarize, can help us move in the right direction, just as we were both alluding to a little while ago.
Yeah, absolutely. And that's a really easy place to start. Easy. Motivational interviewing is so hard. And both of us, I think, sort of articulated, oh, this is what I would do with motivational interviewing. But in case our audience members are a little bit newer to motivational interviewing, please know that it is very difficult. And but we're going to try to sort of give some examples that you can use throughout this presentation so that you can sort of tiptoe more into motivational interviewing and try some of these, but it is kind of clunky in the beginning when you start using it and really start approaching your conversations a little bit differently from a motivational interviewing context. So we support you trying, though. And really, one of the most important things that I find helpful with patients is also the teach back method. And so much of us have been introduced to this piece, but in this context here, particularly if you're speaking in Spanish. My motivational interviewing in Spanish isn't quite as strong as it is in English, but the teach back method is a fantastic way to make sure that you really have communicated what you need to. And I know the times that I really make sure to use the teach back method is, for example, for an insulin titration. I often may recommend to patients, maybe go up by X number of units over the next however many days, up to a maximum of 20 units, for example. And that can have a lot of steps. And so any process that has a lot of steps, I ask for those to be kind of taught back to me. Another one may be, for example, finishing one medication and switching to another. Once you finish this dose, you can pick up your next dose of your medication and then you start that one, and it's once a day, but I don't want you taking both at the same time, and making sure that there's clarity in when you're switching doses, especially. So that teach back method can really come in handy just to make sure your communication is crystal clear and that they've heard the message that they need to hear.
Absolutely. Thank you so much for that, Jasmine. And yes, to everyone, in terms of motivational interviewing, just practice and keep trying, and teach back. It's always, one of my go-to strategies to make sure that the patient is walking away with the information that they need. And, getting back to circles of trust in health promotion, let's talk about faith, family, cross collaboration, and the role of promotoras de salud. Do you have any thoughts, Jasmine?
Yes, Maria, I do a lot of work with community health workers locally, promotoras, and really what we see in this space, that promotoras can build bridges between faith, family, and health, uniting families, churches, community partners in these shared circles of trust that sometimes providers are outside of, right? And not through any fault of their own, but they're just not integrated within those same sort of community circles. Whereas promotoras and community health workers really do have that sort of insider credibility of lived experience of knowing the community resources that sometimes are missing in the healthcare continuum. So pharmacists work collaboratively, oftentimes with community health workers or promotoras, to ensure message consistency and holistic support. And more, we can see examples of how pharmacists are working with community health workers and promotoras, and that work is evidence-based and being published to really highlight a really holistic, effective model of care between pharmacists and promotoras. And so we would be remiss if we didn't mention the role of promotoras in chronic disease here. So Maria, would you feel comfortable kind of going on to the next thing of kind of like the consequences of uncontrolled disease?
Absolutely. And I would say that one of my main motivations in just being here with you all and sharing some of my best practices is specifically helping our communities prevent those extreme complex regimens because they had for instance, in the case of diabetes, a cardiovascular event. So, alluding back to our example of patients with diabetes who are perhaps on metformin or insulin. So here we have an example of the impact when we have a missed opportunity, say in the pharmacy or in the ambulatory care settings, where we may have a missed opportunity of teach back or confirmation that the patient knows exactly what they're going to do when they go home. In those instances where the patient, whether they're leaving the pharmacy or the clinic, and they didn't fully comprehend or understand how to correctly take the medication, that may unfortunately result in a cardiovascular event that may lead to a complex regimen. And so what I would like to share is, unfortunately, in some of the clinics that I've worked in, I have come across certain individuals who unfortunately did end up having a heart attack, in part due to their uncontrolled diabetes, perhaps even uncontrolled hypertension, or their dyslipidemia. And in the pharmacist-run managed clinics, we have the privilege of being able to help the patient understand their medications and how they will keep them healthy. We're helping the patients ensure that the medications, we're helping the patients to learn that these medications, some of them are going to be lifelong, and making sure that they're picking up their prescriptions, or others might be short term. We help the patients navigate prescription refill process to ensure the daily adherence to their medications. We also help them monitor and manage their chronic conditions to understand when their medical condition is controlled versus when they may need to go to the emergency room, and to recognize which lifestyle habits may improve or worsen their medical condition. Any other differences that you may have come across, Jasmine, in the terms of complex regimens and ambulatory care setting?
Maria, you got it. You nailed it. You hit it out of the park. So I won't spend too much time there. I think you did a thorough job of going through that piece. I do want to, Maria, you mentioned hyperlipidemia, hypertension, and I think sometimes, being a faculty member, I think sometimes we don't do a great job as faculty of teaching our students that those are the professional terms. And oftentimes when we are talking to people, we want to take off our professional hat, so to speak, and really make sure that we prioritize using language that is understandable. We get out of the idea of sticking to our jargon. One of the things I tell my students is, if you have said receptor, you have gone astray. There's no reason to be saying receptor anywhere when you're talking to a patient, right? Unless they ask specifically about a receptor, right? So for example, saying azúcar, right? Instead of glucosa, for example, right? Or glucemia. And those are switches that we need to make, right? I remember early on in my career learning that it's a maquinita, right? And it's a tirita and a piquete, right? But I had to be taught those things more so than it was like, for example, lanceta, right? And it's kind of just in English, it's kind of like, oh, the little pricker thing, right? That I used to prick my fingers, right? And using those languages, that type of language and avoiding jargon oftentimes breeds comfort and safety. And I'm not trying to speak over your head. I'm not trying to, I'm my number one priority is that you are understanding everything that's being said. So those are the things that also really are much appreciated, I think, in the Latino culture when we're speaking Spanish as well. So these types of things and using teach back methods is also appropriate here. So I just want to make sure that, I have to remind my students, especially the APPE students who are fresh out of the classroom, right? That those types of words and avoiding jargon should be prioritized. And sometimes I think we don't do the best job that we can as faculty members as making sure that they understand that in the classroom. Maria, did you want to add anything to that?
No, that was perfect. That's exactly right. And the only other thing that I would say is, in working in Northern California versus Southern California, the Spanish, it's a little different, whether it's Mexican Spanish or Español from El Salvador or Honduras, etc. And so if there is a word that, say, I use as Spanish from Mexico and they know it as something else, then I use it myself as a learning opportunity. And so in this, the beautiful thing, at least it's been in my experience with Spanish speaking patients, is that they're so welcoming and they're so friendly and they're always willing to chip in any way, shape, or form. But very well, nicely put, Jasmine. I could not have said it better myself. And the next part in terms of, getting the message across to the patient. So yes, using the right terminology, etc. But then what can we give the patient to take home to further enhance their understanding of how to correctly take the medication? So one of the resources that I specifically most frequently used in the Federally Qualified Health Center were the essentially images to portray messages, whether it was on a handout. Oftentimes I would come across patients who were not able to read or write. Some of them did know numbers, some of them did not know numbers. So we had to get creative, whether it was a chart on, what, like the medications, and then whether we put a sun for daytime or a moon for nighttime, etc., getting creative and making sure that the patient was able to, as Jasmine was talking about earlier, teaching back in the sense of what they were going to do once they went home. So fotonovelas and just images in general, and just having, in a non-judgmental way, being open to patient that, if you're coming across something along the lines of the patient is not able to read, just having that comfort with them to have them perhaps disclose that so you can better help the patient. Anything else in terms of teach back or documentation, Jasmine?
I don't think so, Maria. I think we have a couple more slides here, but I think we've really hit home the idea of teach back, and I think that goes really well even if you're using some of those tools that you just mentioned, Maria. Right? It doesn't matter if I'm only speaking, if I'm using some visual aids. The teach back method is going to be important using any of those things, right? Is how do I wrap up, sometimes my students have trouble so-called landing the plane, right? They don't know when to stop asking questions. They don't know, did I do the thing? Am I done? And I think the teach back method is actually landing the plane. Can I double check for understanding in this appointment? And on the slide here, we have an example of how that might be phrased, right? Can I check for understanding? But then I think what's also nice here is the follow-up. And because sometimes someone can teach back, you can reinforce, you can provide handouts, all these things, but you're still kind of wondering, are we going to be okay there? And especially if, we haven't even touched on if somebody has cognitive memory problems, something like that, but there's no reason why you couldn't potentially follow up in a week and by phone. Don't make the person come back in, have them and talk to them on the phone. How was that going? Can you repeat back to me how that's gone since we last spoke? Those types of interactions can go a long way, in addition to the teach back, right? And then documenting any piece of the interaction that you find to be a piece of the puzzle, I think is also nice as well. I know for me, I have to document it well so that I can look back and say, what did we talk about? What did I want to make sure we went through this time? So just that documentation, follow up, even if it's a brief phone call, can really ensure safety and really goes a long way for rapport as well in terms of having another touch point with the patient. Anything to add there, Maria?
Yeah, absolutely. The only thing that comes to mind is perhaps for our new learners or for those who are starting to get comfortable with TeachBack. I will admit it does take time at the beginning, but if we're new to the clinic or the patient is new to us, there's going to be essentially an amount of time that we will be having a relationship with this patient. And it's been confirmed, at least it's been confirmed in my experience multiple times, that if we just take that time at the very beginning and invest it with the patient from the very beginning, I do strongly believe that the patient will get the benefits, the outcomes will show for themselves, how much the patient was able to understand. So definitely encouraging us all to use the teach back method as much as possible. And over time you'll come up with your own strategies and techniques to best apply it. And then even so to pick up on cues from the patients, whether it's verbal or nonverbal, just to kind of gauge what it is that the patient really needs in that particular setting.
Beautiful, Maria. Perfect. As we're wrapping up here, I really just want to reiterate one of the general messages I think that we're really trying to hit home is that language is where trust begins. And as we kind of promote transparency, trust, and create safety in the relationship with the patient, basically like every refill, every patient interaction that you have is a real chance to deepen your connection and that level of trust with a patient. I think that that's probably one of the overarching messages that we've been trying to promote with this presentation. What about you, Maria? Any other take-home points that you'd like to emphasize?
Yes, absolutely. Just one little teeny tiny tidbit, and that is that taking the time to understand our patients and the lens from which they see their world may help us clinicians, pharmacists, pharmacy staff to better serve them and contribute to the improvement of their community. So just a few thoughts to ponder.
Absolutely. And what about pharmacists in the role of team-based care, Maria?
Yeah, no, I believe that pharmacists, we truly are the champions of collaborative team-based care as we place the patient in and their family in that particular center.
Maria, this has been an excellent discussion. I've really enjoyed our time here together. And I think it's important for us to share with the audience. I like to call them SMART goals. You may have heard of SMART goals, specific, measurable, attainable, relevant, timely. And I like to add the IE in terms of being inclusive and equitable. And I want us all to think about what SMART goals can we come up with as a result of participating in this presentation today. So for example, I'll just mention a few here. Over the next 4 weeks, ask every Spanish-speaking patient about home or traditional remedies, record their responses, and screen for potential medication interactions. That would be an example of a SMART goal if you would want to set that for yourself. Another one may be within 2 months, collaborate with a community health worker or promotora to coordinate a follow-up or referral for at least one patient population, for example, in those with diabetes or hypertension. So those are just examples of what you might walk away with today to really have something tangible to really kind of emphasize your participation and your time spent here today. So thank you so much for spending time with us today. Maria, do you have any last comments?
No, thank you all for listening and hearing our thoughts. We hope that you are able to go back to the setting that you work in to best help your Spanish-speaking patients. Thank you.
Perfect. So please see the wide range of resources on the CME Outfitters website. The CMEO Health Access and Social Responsibility Hub also has more resources to help increase your skills in fostering a welcoming, fair, and inclusive environment. This program is part of a broader initiative focused on helping pharmacists and pharmacy technicians enhance culturally sensitive communication with Spanish-speaking patients. The first introductory one on bridging cultures, foundations for serving Latina patients in pharmacy settings with Maria, as well as one with Dr. Robert Mueller titled Speaking with Care, Spanish Essential for Patient Engagement. These are excellent programs that we hope you'll be able to check out. To receive credit for this activity, please complete the post-test and evaluation. We appreciate your feedback and want to hear from you. Tell us what you liked, how we can improve, and what additional topics you would like us to address. Thank you so much, our audience, for your attention today. And thank you so much, Maria, for your time today.
And thank you so much, Jasmine, for your unique insight. And it